is arthritis?
Arthritis means an inflammation of the joint. There are so many joints, 206 joints in the bones in the body.
You mean to say that arthritis can happen in any joint?
Yes, of course.
डॉक्टर साहब की अगर menopausal women है तो उनका ये degeneration और ज़्यादा जल्दी होता होगा?
बिल्कुल बिल्कुल.
तो सर ऐसा कुछ आ गया है come to know कि ये genetic problem है?
Yes, they may have negative results. So there is no single test you can tell that this patient is HLA-B27. Morning stiffness, if it is more than 1 hour, that is significant.
Obesity will absolutely play a negative role then for arthritis.
Yeah, if your BMI goes beyond 35, then that is like
Really
warning signal.
warning
Yeah,
signal.
that's like red flag. Now, and some patients are there who do not want to take up any surgical issue.
Right, that is a big myth.
Very big myth, yes.
So can you just appraise us with what kind of implant and what are the restrictions if you do a TKR?
Should not sit cross-legged on the ground.
Okay.
Otherwise, sports can be done like swimming.
Now are there better conditions where surgical stays less?
We need to optimize the patient before the surgery.
So what is robotic surgery, Dr. साहब आप करते हो ना robot करता है?
Basically, there is a man behind the robot. So, early return to work, early return to motion
Everything
by
is
the
becoming-
robots.
हाँ.
Taking the robot will not make the surgery much better.
Namaskar. I welcome you all to another episode of Kalinga MedTalks. My name is Nilanjana Mukherjee. I'm the Managing Director of Kalinga Hospital Limited. Like earlier episodes, today also we have an interesting topic called arthritis. Darad. Jodo pe darad. That is what we are going to answer by a very eminent doctor, Dr. Sanjeev Patnaik, who is associated with Kalinga Hospital Limited. He's a senior consultant with us. I would now request Sir to introduce himself and also mention the areas where he specializes in.
Yeah, hello. I am Dr. Sanjeev Patnaik. I am a senior consultant orthopedics and joint replacement surgeon at Kalinga Hospital, Bhubaneswar. As per my areas of expertise, I do joint replacement surgeries along with sports medicine and complex trauma cases, which includes pelvic and acetabular trauma. Now, I have a rich experience of about 22 years post-MS, and I've worked in various places. I did my MS from SCB Medical College, Cuttack, and senior residency in New Delhi at various hospitals, which are centers of repute for joint replacement surgery. And I had a brief stint in UK as a senior house officer there. And after coming back to India, I practiced in New Delhi for 6 years before joining Apollo Hospital in Bhubaneswar, and that was almost 12 years. And again went to UAE for 1 year and came back, and I am now associated with Kalinga Hospital as a senior consultant orthopedics and joint replacement surgeon.
So thank you, sir, and it's a wonderful experience working with you also. So today you know the topic. It is arthritis. So it's a very common word which we use, sir.
Yeah.
But what is it actually? What is arthritis when we speak?
Scientifically, if you speak, arthritis means an inflammation of the joint.
Okay.
Because any itis is inflammation and arthro is joint. So, inflammation of the joint. So, it's a very broad-minded term that you can say arthritis. But see, the question is, who are the patients for arthritis? So, there are so many joints, 206 joints in the bones in the body, and lot of joint arthritis, what we normally see in day-to-day practice is involving the weight-bearing joints. Sometimes we see small joint arthritis, especially if it is a case of rheumatoid arthritis. There are hundreds of varieties of arthritis.
So that means you mean to say that arthritis can happen in any joint?
Yes, of course.
Any joint?
Any
right?
joint.
Okay. Now, what you try to right now say that rheumatoid arthritis,
Yeah.
are there any varieties of different kinds of arthritis?
Yeah. So if you broadly specify the varieties of arthritis, you can say there are inflammatory arthritis, there are non-inflammatory arthritis, which includes degenerative arthritis, which is basically a wear and tear of the joint as you age. That's an aging process. But then also you can say that not every person who ages has arthritis.
Okay.
There is a subtle form of arthritis which goes on in every person. But for that arthritis to become debilitating, that means it restricts the day-to-day activities of daily living. So there are so many factors which are involved. So once we see a patient of arthritis, we tend to classify it, whether it is an inflammatory arthritis
or a
degenerative arthritis. And there are also stages of that arthritis. As you can say, in stage 1, these are the earliest form of arthritis, stage 1, stage 2. And especially once you say arthritis, it is not only involving the bones. Because a joint consists of bones, although there are bones, and associated soft tissues around the joint.
Okay.
That means we have ligaments, we have cartilage, we have those soft tissue that is known as the synovium. The synovium is the layer of the covering of the joint. So all these can be involved in that inflammatory process, and that includes arthritis.
So Dr. Saab, abhi aap bole ki there is an inflammatory arthritis and there is a degenerative arthritis.
Yes.
Now I want to ask you that, is there any age bracket for this? Like inflammatory and degenerative, have they a separate age bracket for this?
Yeah, definitely, because these type of inflammatory arthritis can run in families also. So there can be a genetic predisposition to these type of arthritis. As you can say, ankylosing spondylitis, rheumatoid arthritis, psoriatic arthropathy, and then
ये generation से आता है.
Yeah, generation से आता है. But there are also environmental factors, which includes that. For example, somebody is a smoker or has drug abuse. Some people are taking steroids for some other reasons, because you can club all these into collagen vascular disorders. There is a continuum of arthritic conditions which is known as collagen vascular disorders. It can start from simple conditions like you can have the axial skeleton may be involved, or the appendicular skeleton. That means you have the small joints of the hand, हाथ के हैं,
or
axial
spine का हो सकता है.
No, yeah. Usually rheumatoid arthritis is considered as a small joint arthritis. It can involve the cervical spine also, and sometimes in rare situations, big joints. But if you see ankylosing spondylitis, it involves the axial skeleton more, spine.
Yes.
So that the patient becomes stiff, and sometimes there is deformity, bowing, kyphotic, and scoliosis. All this can happen.
Yes.
So these are the forms of arthritis. But the other form of arthritis is end stage arthritis, which starts from the age, say, around 45, 50, like that.
Okay, so
yes,
early. Okay.
That is degenerative arthritis. And it happens with everybody, with our lifestyle. And now it is being seen that it happens earlier because we are more sedentary, because we are not going outdoor, doing outdoor activities. So these type of arthritis are seen much earlier, and earlier so in females, maybe because of the hormonal changes which happens. And usually it is seen that a decade earlier in females and as compared to the males.
Okay.
There is also a correlation between the bone mineral metabolism, like calcium, vitamin D, whether they have any deficiency. This also influence how or when the arthritis can start.
So you mean to say, Dr. Saab, कि अगर menopausal women है तो उनका ये degeneration और ज़्यादा जल्दी होता होगा?
बिल्कुल. Because ये post menopausal osteoporosis जब included हो जाता है, तो उसमें क्या होता है कि bone का जो strength है वो भी धीरे-धीरे downhill जाता है. So if we are not supplementing these women with vitamin D, with calcium supplements, sometimes with hormonal supplements, then it can take a more fast downfall. Yeah. So arthritis उनमें ज़्यादा जल्दी दिखाई देता है.
Right. So tell me something. My father was a patient of ankylosing spondylitis. Now when I went for my checkup, there were certain blood tests which were done कि देखने के लिए कि ये जीन में है कि नहीं. तो सर ऐसा कुछ आ गया है कि हम देख सकते हैं कि if there is a pain for my children or we come to know कि ये genetic problem है कि नहीं?
No, there are some human leukocytic antigen test जो HLA-B27 test होता है, उसमें बहुत पहले हमें पता चल जाता है कि you have a genetic predisposition. But 50% of the patients who are ankylosing spondylitis, they may have negative results.
Oh, okay.
That means even if you are an ankylosing spondylitis patient, you still may be negative with HLA-B27.
Okay.
So there is no single test you can tell that this patient is a HLA-B27. So along with the test, we need to see clinically.
Other parameters also. Okay. And tell me, what are the typical signs of arthritis when we know that this thing is going to go?
Basically, when a patient comes to us, the problems will be, first is pain. Number two is stiffness. The joints get stiff. And because there is adjoining, the muscles also become weak, fragile. So that also adds to the stiffness. There might be in certain situations, especially the inflammatory arthritis, where there will be swelling, effusion, there will be joint fluid inside. That means there is an increase in joint fluid. So they will come with swelling of the joint. Sometimes there will be inflammatory changes like redness, increase in warmth, and they will be basically restricted in their activities of daily living.
They will not be moving.
Yeah. So those
So
are.
ये जो सुबह when you get up in the morning, you can't stand up, or your joints
Morning
are
stiffness.
paining.
Yeah, that is a very typical feature of rheumatoid arthritis.
Okay.
They will have morning stiffness, and that morning stiffness, if it is more than 1 hour, that is significant.
Oh, that's a very important.
बहुत लोग बोलते हैं कि morning stiffness हो गया, मुझे सुबह उठते ही stiff, but we ask them how much, कितना समय.
Okay.
अगर वो बोलेंगे 10 मिनट में ठीक हो जाता है, that is not morning stiffness, which is conducive for arthritis. So morning stiffness, if it's there for 1 hour or more, then that is significant.
And Dr. Saab, what is it regarding air conditioning? When there is a lot of people who complain of stiffness staying in a lot of air conditioning and less of sunlight. Does it affect that?
Yeah, indirectly it affects, but not directly. Why I would say like that? Because if you are in a gust of cold air, your body genuinely becomes stiffened. So that is not like arthritis.
Okay.
So in that situation, if you take a warm bath or you just sit in the sunlight for some time, your joints will become again supple and you can move your joints.
Okay.
But morning stiffness, which directs towards arthritis, that will not be genuinely, I would say, that you will not get a better by taking a warm bath.
Okay. It will happen as it is whenever.
As if it,
तो this Dr. साहब has said a very pertinent point कि आपको अगर सुबह में उठ के आपका स्टिफनेस 1 घंटा तक रहता है तो आप मत सोचिए कि इट इज नॉर्मल. आप प्लीज डॉक्टर को दिखाइए. देयर मस्ट बी सम अर्ली साइंस विच वी कैन प्रिवेंट टू गो टू द ग्रेड 4. नाउ डॉक्टर साहब ये बताइए कि फर्स्ट स्टेज से ग्रेड 4 में व्हाट आर द एरियाज वेयर वी कैन प्रिवेंट देम टू गो टू दैट स्टेज?
That's an interesting question. Because prevention, we are all there for prevention. It's not that every patient who comes to a doctor will go for the surgery.
Exactly.
So that is not our job. Our job is to treat the patient as and when it comes, and prevention plays a very important role. Whenever we see a patient at any stage of the disease, we advise physiotherapy of the patient. And that includes how you can decrease the stiffness of the joint by doing regular exercises. And you can take the help of physiotherapists for that purpose. And simple, if you sit in the sunlight for maybe an hour or so and take constant vitamin D and calcium supplements along with 2 regular exercises, you can take care of the muscle mass as well as the joint. You can prevent joint stiffness. And there are in certain situations where we advise them to go outside, because a lot of people nowadays are sedentary. They are in the computer job, they are in the banking sector, they are sitting all the time. So we advise them at least 1 hour, go outside, take a run, maybe walk, or do some kind of stretching exercises, yoga, Pilates, or any other sporting activity which you love. So those are the things which will definitely help to prevent stiffness. And also it improves the muscle mass. Because muscles are the things which run the joint, they move the joint. So if your muscles are weak, your joints will become worse. So along with the joints, you have to take care of the muscles. Regular exercising, going to the gym, doing some yoga, stretching exercises. If you are fond of swimming or any other exercise,
that is also very good.
That is also good.
But sir, obesity will absolutely play a negative role then for arthritis?
Yeah, obesity to a certain extent, it exaggerates the process. But as you can say, obesity as such is a predisposing factor. But if your BMI goes beyond 35, then that is like really warning signal. That's like red flag. So BMI, we have to keep a count on that, because along with obesity, what happens, you become more sedentary. It becomes very difficult to go outside, and your joints become more stiff. There is a lot of pressure on the joints, so degenerative process also is much faster. and moreover, it's like a what do you say, like a downhill process.
Yes.
Because these are also they have psychiatric issues also, and that also inhibits them to go outside.
Yeah.
So that psychological factor is also there.
Is there.
Yeah.
And so they don't want to. They just don't want to move.
Yeah. So again, there are associated factors which are also very important. So we have to take them out of their comfort zone and tell them that they should go for some kind of exercise. At least they should control their BMI.
So you covered stage 1 arthritis, stage 2. What do you talk about stage 3 and stage 4?
Yeah, there are so many medications right now. There are newer modalities of therapy which we can try. The initial stages, we advise them with kind of braces, knee braces, and supportive assistive devices.
Okay.
Sometimes using a cane or maybe a walker, which will help them in their day-to-day activities. And we definitely advise them for physiotherapy. So that strengthens their muscle and they get into that cycle of exercises. And in later stages, especially, once we see that the grade 3 has gone into grade 4,
right.
Now, and some patients are there who do not want to take up any surgical issue.
Right, that is a big myth.
Very big myth.
They will stay with the pain, but they will not go for surgery.
Yeah, we have some medications for them. We have intra-articular injections. Nowadays, hyaluronic acid, you must have heard about hyaluronic acid. And these are the wonder agents which are being injected into the knee joint, and they act like natural lubricating agent, synovial fluid, and they will help to certain extent. There are newer therapies like stem cell therapy and plasma PRP injections which are there, that is plasma rich, platelet rich plasma. So those are the newer modalities, but studies are being conducted nowadays, and there is no direct FDA approval for these type of agents. And definitely longer study is required to corroborate whether they are actually helping or not. Now, once this arthritis reaches to stage 4, and we see totally worn out cartilage and end-on-end, bone end-on-end appearance radiologically, and the patient is having severe symptoms, and along with that, if somebody has deformity like a varus or a valgus deformity, the bow legs and the knock knee, those things happen, and then we don't have any other option rather than to go for surgery.
Okay. Now, Dr. Saab, surgery, as I told you right now, is I also face these questions. I have seen so many patients coming and telling me ki surgery kya zarurat hai. They put an Ayurvedic tail and they will put all sorts of alternative medicine therapies and not go for surgery. But being in this field for so many years, what I've seen is that the doctors right now, replacement surgery, they're doing a commendable job. There's a hospital stay for hardly 4 to 5 days. And I think post-surgery, Dr. Patnaik also makes his patient walk within 6 to 7 hours. So I would like to know, Dr. Saab, which the viewers need to know, is that why should we not go for surgery? How safe is the surgery?
As a surgeon who has done more than 10,000 joint replacement surgeries, I would say it's a very safe surgery, because there is a checklist of all the parameters which we do before the surgery, and we take up those type of cases which will definitely have good results. So getting a good result is not just randomly picking patients.
Anybody and everybody.
So we have to optimize the patient. There is a myth that once you do joint replacement surgery, you will not be able to walk or go outside. There is a very big myth, and there are a lot of patients there who are almost like they can do everything possible but no surgery.
Yes.
So I would like to advise them, these type of patients, that surgery is a very, very successful the outcome of surgery is highly successful, almost 99%. And nowadays newer modalities of treatment are there. Although conventional knee replacement surgery, we have been doing that for last 50 years. And that is one of the most successful surgeries of the century, it has been told. This joint replacement surgery, it has changed livelihood of patients. And because they can now do whatever, the outcome of the surgery is so good that they can return back to their activities of normal living. So there is no point that somebody has to suffer lot of pain.
Just with this myth that surgery nahi karna hai.
Ye pura myth hai. Actually, we have to break that myth.
So, sir, you use an implant in a surgery, right? तो बहुत questions आती है कि can I fold my leg, can I sit down?
Yeah.
So what I have seen that the implants have really developed over the years.
Absolutely, yes.
So can you just appraise us with what kind of implant and what are the restrictions if you do a TKR?
Yeah, the only two important restrictions which I would advocate in any patient is should not sit cross-legged on the ground.
Okay.
So that means has to be chair-bound, commode habit, all these things are required. These are one restriction. Number two is that he cannot go back to sports like running and jogging.
Okay.
Otherwise, sports can be done like swimming, playing golf, where limited activities are there. And you can go back to your activities of normal living means walking. You can maybe have a brisk walk or a light jog, that is okay. Doing the treadmill, cycling, all these are okay after a joint replacement surgery. And as far as the implants are considered, nowadays we have high flex knees, which allows the joints to be folded almost more than 120 degree. And that's almost like a wonder. It's a high flex knee. So most of these patients are elderly. Their activities as such are restricted.
Yes.
But if we can give a pain-free joint with a very good range of motion from 0 to 120 degree of flexion,
it's good
with
enough.
Good stability. And these implants, most of these implants have a survivability of almost 25 years.
Okay, so once implanted, 25 years you're...
Yeah, so that means the surgery has to be done also equally in a particular way. Yeah.
So डॉक्टर साहब और एक चीज़ है यहाँ पे बहुत इम्पोर्टेंट है कि अभी सारे इम्प्लांट्स जो है हमारे पास आते हैं कि these are foreign made implants and imported. Does India make affordable implants? Can the people afford these surgeries?
Nowadays, as you can see, we have all these government related schemes and we are doing all these surgeries free of cost. So we have those adequate implants which are indigenized and they are at par with the best in the market. So they are at par. So there is nothing to worry about. The implants, the quality of the implants, as you can see, which are US FDA approved, are also approved in India. And we have our Indian standards also, and they are equally good. We have done more than thousands and thousands of Indian joint replacement surgeries, which is equally as at par with the Western world.
You pointed out a very pertinent point about arthritis is lifestyle.
Yeah.
So lifestyle also included body weight and smoking and all these. Now, after a replacement surgery, what are the lifestyle modification other than sitting down, not jogging?
Yeah.
Is there that, drinking, smoking, body weight, everything has to be controlled?
If you are a diabetic patient or you are having any other comorbidity like a heart-related ailment or sometimes a respiratory disease like a chronic obstructive pulmonary disease, I would say you should not smoke. Smoking is one factor which
will again make it worse.
Yeah, because any joint replacement or a major surgery
is always
a risk factor where you need to cut down on all these. Heavy alcohols or maybe heavy smoking are not permitted. But everything, if you take an isolated thing, you are maybe taking alcohol maybe once a week or so, that is okay. And not a chain smoker, but maybe a few smokes a week, that's okay. But what I mean to say, if you are having these pre-morbid conditions,
it's better to
avoid all these things.
And there is another very common thing which comes in, where most of these surgeries, when the females are undergoing the TKR, total knee replacement surgeries, they develop UTI and catheter urinary tract infection, which used to happen when the surgical stay was much more.
Yeah.
Now, are there better conditions where surgical stay is less?
Yeah, as I told earlier, that we need to optimize the patient before the surgery.
Okay.
If you want to get good result from every surgery, the patient optimization factor is very, very important.
Okay.
That has to be taken into account. If you just select without optimizing the patient, somebody has a urine infection earlier, there definitely he or she can have a UTI later after the surgery.
What about diabetics?
Diabetes also, you need to optimize the sugar levels. That means you have to look at the HbA1, HbA1c levels. It should be hovering around 7, 6.5 or 7. If somebody's HbA1c is 12 or 10, then you need to optimize the sugar levels. Then consider any major surgery like knee replacement surgery.
Yeah, because the age group as it is in a vulnerable age group
Yes,
criteria.
yes.
Now, Dr. Saab, lot of people say that the diabetic patient, if there is an implant put in, the body starts rejecting.
No.
Is that a case in this case?
It is totally wrong.
It's wrong.
Most of 50% of our patients, after all, India is the diabetes capital. So 50% of our patients are diabetics. They are hypertensive. They might have some cardiopulmonary issues also. They are doing very well with joint replacement surgery, and because we have optimized the patient, and also after the surgery, once the patient becomes more mobile, can do the daily activities, these factors like diabetes and all these are also easier to control.
Easier to control,
yes.
Because at that time they did not.
Yeah, definitely, because those were the factors where they could not do all their daily activities, and that was getting hampered. Now after the joint replacement, there is a renewed vigor in them to do all these activities, and that helps.
And nowadays everywhere in the poster it is called robotic surgery.
Yeah.
So what is robotic surgery, Doctor Saab? आप करते हो ना, robot करता है?
Yeah, that's a misnomer actually. See, the robotic surgery, basically there is a man behind the robot. Definitely robots are there, and they are going to rule the markets in the years to come.
Okay.
Because latest advantage and technology, we should go hand in hand with that, because there is everything has to be focused on patient care. If we can give better patient care with the help of robotics, I am with it. Because these technologies, they help us to produce much better and finer, refined results.
Okay.
The precision of the surgery goes a notch higher with the robotic surgery. And after all, robots are controlled by humans. You have to be basically a good surgeon so that you can have better results with the robot.
And also robotic
not
training.
Vice versa. Taking the robot will not make the surgery much better unless you are a better surgeon and the robot goes hand in hand with you.
Wow. Yeah. So it is the surgeon's expertise.
Yes.
Where the robot just helps the surgeon's expertise.
Absolutely.
And the surgeon is also so there is any special training which the surgeon goes through?
Yeah, there is a learning curve.
Okay.
For the first 40-50 cases, there is a learning curve. Now, because what happens is that, why it is better? Because before all the cuts are made for the joint replacement,
everything is better.
Robot will give you the optimum position of the implant, the size of the implant, the balance, the ligament balance, how you will achieve if you use this size. So all the information that you get are before any cuts are made in the bone. And how the robot helps us? Now the surgeries, the incision becomes smaller. You are more precise fitting, so it's more longer lasting implants. And then there are more smaller cuts, so the soft tissue damage is also less using the robots.
Okay.
So early return to work, early return to motion by the robots. Yeah. Yes.
So it's like driving an Airbus or a Concorde or something which is a high-end airplane where the pilot gets much more advantage having a very high-end equipment.
Just imagine a pilot landing an airplane,
which is absolutely
you have totally 100% visibility is not there.
Perfect.
And you can land the plane just using the autopilot. So in this situation, if we have an extra articular deformity, if the patient is highly obese and you don't know where are the parameters,
so
sometimes you have the screen, your robot helps you in that situation.
Okay.
So I would say in 10% of our surgeries, robots are going to help us. And mostly 90% of the cases, robot may not be required. So we can get very good result with conventional, but in those type of 10% cases, complicated cases, robots are there to help us.
Okay. So when I was talking to sir before this podcast, you were telling me that arthritis is totally infested in India. Like India is going to be one of the big areas.
See, just as we are the diabetic capital of the world, I think within the next 10 to 20 years, we are going to surpass even USA and China in arthritis.
My God.
So almost about, if you see the whole world, about 500 million people are affected with arthritis. And that's almost going to double up in another 20 years.
My God.
So you see the backlog of cases where we can get, if we are not trained now, then when?
Yes.
So that is what is very important, that we should have this knowledge about arthritis, the various modalities of treatment, and what are the latest advances in this field.
So to end this session, arthritis is a very common word. You live with the pain, but why do you live with the pain? Why can't you be treated for the pain? Why? Because as Dr. Sanjeev Patnaik mentioned very correctly, if my productive years are only painful, then what do I do? How do I work? Second thing is, when the way of life, when you can afford it, if your way of life, अगर आपकी ज़िंदगी बेहतर बन सकती है और हमारे पास टेक्नोलॉजी है, तो आप उसको अवेल कीजिए। हालांकि जो स्मोक कर रहे हैं, जो ड्रिंक कर रहे हैं, जो मोटापा से गुजर रहे हैं, उनको सब कुछ बंद करके सोचना पड़ेगा कि नेक्स्ट 25 years or 30 years of my life, how I will be mobile. So at Kalinga, we want to end this podcast with a very positive note that when you have a pain or you have a knee pain, don't go by this myth कि सर्जरी नहीं करवाना है, सर्जरी तो छूना ही नहीं है, उससे अच्छा है आयुर्वेदिक तेल मलिए, which is absolutely a myth. So thank you very much for being with us, and we will come up with much more of these topics. Namaskar.
Thank you. Namaskar.